unstable vitals. These unstable vitals. So first thing is that if you press that we have button, this is our mannequin operator. Show him to press the button, and then it will have some sound. So it has audio cues. The patient is in altered sensorial, he is not breathing properly, and in such patient, what we need to do and what we need to teach our candidate that his airway is obstructed. Can you see Lukman? I mean, can you see the mannequin, Lukman, clearly?
We are able to see the mannequin, sir.
Okay.
Yes.
Okay. So when patient comes with altered sensorium with this kind of breathing, that is which airway is compromised. So we need to do a jaw thrust. So I will just demonstrate a jaw thrust. Now his breathing has cleared, and this is audio cue also that you can know your jaw thrust is effective. So after I hit the jaw thrust, his breathing has returned to normal. So this is demonstrating the airway, and simultaneously you can apply cervical folder. You can do BVM. Okay. So this was A. I will go by ABCD protocol. Now coming to B, now this patient is a patient of polytrauma, and now they are abrasion. Okay, onto this side. So when you have abrasion initiation of polytrauma, you suspect something like either he has a pneumothorax or pneumothorax. Of course, you arrange the vitals accordingly. So if you press his ribs, so he will groan.
Hello.
So you can see because there is underlying rib fracture, the patient is groaning. Now, if we do the X-ray of this patient, because you have to be biased in trauma treating, either he has got pneumothorax or pneumothorax. So we did the X-ray, and you can see on the X-ray there is a right-sided pneumothorax, and we have this ultrasound simulator. If you have ultrasound facility, So this patient has always known that something needs to be done urgently. He is an ultrasound constantly growing. So if we do the ultrasound of such patient, it should be done at the earliest opportunity. What we will get, this is what we get. This is like the ultrasound. This is the absent lung sign, indicating that this patient has got pneumothorax. If you don't have ultrasound, you can have the X-ray, and that shows right-sided pneumothorax. Now I will do the paracentesis. So we will demonstrate now tension pneumothorax, how it should be decompressed. It is available in our mannequin also. And before that, the patient is breathing. He is having a rapid breathing. Please kindly note down his respiratory movement, because this is moving on less on the right side. So indicating a scenario for tension pneumothorax. So and again, if you tie this belt, then you can have this distended vein, the breath sounds, and that X-ray. So this is a scenario for pneumothorax, tension pneumothorax. So if you do the paracentesis, you will see, you can see the air rushing out. So that confirms, and then you need to put the chest tube. Are you able to see, Lukman?
Yes, sir.
Yes.
Lukman?
Yes, sir. We are able to see. No, Sajid, Anup, Mr. Sajid.
Yeah, we it's able to see. Okay, yeah.
Okay, yeah.
Lukman, are you seeing my intervention I'm doing?
Yes.
Okay. Could you see the decompression of the tension pneumothorax?
Yeah.
Would you see, or should I demonstrate again?
No, we are able to see. Yeah.
So that is a whether when we eject, that is auto sealable. That currently when
that is
you
auto
do.
sealable. Yes, that's right.
Okay.
So that was needed decompression of tension pneumothorax, and that was our ultrasound simulator. Now moving to C. So it has got 3 pulses. So if we switch on this button, pulse will come. So it has got carotid, it has got femoral. You can feel pulses in this mannequin. And we have got DPA also. Because we have given, now we are going to C. So in C, we have, there is a fracture of this bone on the left thigh. And if we want to demonstrate how to apply a cap lubricant, then we show the catastrophic hemorrhage. Show them the catastrophic hemorrhage. This is the hemorrhage this patient is having, and now you have to apply the cap lubricant. Now we will show how to apply a cap lubricant to stop the catastrophic hemorrhage. So these are the various features I am demonstrating. So on this mannequin also you can teach candidate how to apply a cap lubricant to stop the bleeding. Now the bleeding has stopped. Okay, moving further. Now, if you want to make a scenario for the like there are no ways available, then you can go for IO access. We have given IO access facility in this mannequin. I will just demonstrate the procedure also. Stop there once you get a clear feeling and aspirate. So if you don't find any way, you can go for IO access. So only multiple puncture, both blood both facilities.
Okay, okay.
So you can see the blood is coming. So you can start transfusion. When
Okay,
that means that no veins are available. Okay, so you can go for IO access. Now again, the patient again deteriorate, blood pressure goes down, then definitely we can suspect fracture pelvis. So now this is the X-ray which shows there is a multiple fracture in the pelvic rim. Can you see, look, ma'am?
Yeah,
Yes.
yes, sir.
Okay, so now we can teach them how to apply a pelvic binder. So this is our pelvic binder, and we have given, see the pelvic binder has to be tied on the greater trochanter. So we have given the greater trochanter in this Molar patient. So you will tie the pelvic binder at the level of greater trochanter. So you can teach candidate how to apply a pelvic binder. And then we have urethral bleed also, hidden injuries. You can show urethral bleed, that is the pelvis, there's a bleed, so there's a hidden injury. Okay. Moving to B. Now this patient is in altered sensorium. Why he is in altered sensorium? Because he has got a head injury. So we have given him a head injury on the left side, and his left pupil is dilated. I'll just show you the pupil. You can see the left pupil is dilated. That's why he is in altered sensorium. Okay. Now moving to E. Then you do the log roll, and if you see it, you do the log roll, you will see the hidden injury at the back of the patient. You can see. Can you see, look, man?
Yes, sir, yes, sir, yes.
So this is hidden injury. Just to emphasize the point that whenever indicated, one should do the log roll. So these are the various features in our Murad patient. And further, if you want to do a different scenario, like a stab injury of the chest, if you want to run a scenario for stab injury chest, then you can attach it. And if on ultrasound simulator, you will see, because in chest injury, you need to do ultrasound if patient comes with hypotension. We just have ultrasound finding when the patient of chest injury, stab injury comes with hypotension. What will you see? Probably. So this is just a simulation, preset scenario. So this is what you see. This is a cardiac tamponade, and you need to do pericardocentesis urgently and take the patient to the operation theater. So these were the various features in our molar patient, and hopefully it will be very helpful in teaching ABC protocol, because when you use monitor, there is a safety concern, and that's why we have designed this low cost manikin. And one more thing that you can do pericardiocentesis also, landmark pericardiocentesis. So I just demonstrate pericardiocentesis also in this patient. And please note that the patient is breathing spontaneously. Focus on the chest. Where are you? Focus on the chest. Yes. So you can see the blood coming out. So we can do pericardiocentesis also in this sanity. So there are various skills we can perform, and these are the various features we can run from a scenario. Okay, so that was our molar patient. Maybe I have missed, or maybe not, one or two features. Now we will go for ICD demonstration. Chest tube, how to put a chest tube in our mannequin. That's a chest tube.
So wait for 5 minutes and we prepare for a test tube.
Lukman, you are going with the same model what you have mentioned in the RFQ, right?
Now we are going to show the ICD now. We have quoted ICD and
Yeah.
UO and bleeding. So all the features are same what you see in the tick. But there is separate skill trainers. Now he will show the product.
Okay, okay.
This needle decompression, this is the process. ICD he will show now. That will be only torso.
Okay, okay.
But one advantage is we will give a proper training along with the mannequin. You can understand the capabilities. He is Boston trained this thing, doctor. He is emergency physician.
This is our
Now, this is a model we have, yeah. This is a model we have quoted.
Okay.
So I will do now. This is a separate mannequin for skill demonstration. This is like I will be demonstrating needle decompression and the ICD. Okay. So when you press this button, show the button, it automatically creates artificial pneumothorax, tension pneumothorax. So we have given the landmark. This is the sternal angle, and the space below the second rib is the second, then third, and the fourth. So now the recommendation is you have to go just adhere to mid-axial line, either in the fourth or the fifth intercostal space. So I'm going to demonstrate needle decompression in the mannequin. You can see air coming out. Okay. So this is, you can listen even hissing sound also.
Okay, okay.
Okay, this was needle decompression. Now I will demonstrate ICD. So on the left side, we have given ICD. So again, we will going in the fifth space. Second intercourse, this is the sternal angle. So we have given two spaces to practice, fourth and the fifth. So I will be going in the fifth, just adhere to again mid-axis line, upper border of the lower rib. Give approximately 1 inch long incision, dissect and dilate. We have given muscular tissue also. And then you close the cavity and pop the pleura. Please get to the pop sound, the deep wave, the loss of resistance. That means you have considered the pleura. And now you open the cavity and bring it in the open state. Then you do a finger sweep. You do a finger sweep. That's it. This is attached to a ventilator simulator. You can feel the inflation and deflation of the lung also. So I am feeling the lung also inside the thoracic cavity. Okay. So now this much finger has gone. So safely you can insert your cavity this much. Insert till the 2 centimeter beyond the last eye. Okay. Now connect to underwater drainage. And now this is the tension pneumothorax. That was the scenario. And you can see the bubbling.
Mr. Anup and
Yes. We are seeing. Just show that.
suppose this thing.
Okay. So that was ICD. Okay. Now I will demonstrate surgical cry. So this is our surgical right mannequin. As the injury suggests, that is a difficult intubation and you can't even put the mask also. So I will demonstrate the technique for doing surgical right. Surgical right is there. Look, man.
Yes, sir. Yes, sir.
Okay. So this is a 3-finger technique. You have to stabilize the larynx with 3 fingers, with your middle and the thumb, and with your index finger, in the cricothyroid space. And of course, before that, you can do a laryngeal handshake to do the anatomy. Do a laryngeal handshake to find out the anatomy of the larynx, and that means 3 fingers in the cricothyroid space all the time, and then give a vertical incision. Again, approximately 1 inch long. And then do a dissection, but the blood dissection. And another stab. Now we have reached the area and dilate with your fingers. You can listen the hissing out of air. Now we will pass the bougie. Never leave the space. Pass the bougie. And over the bougie, pass the trichoscope. So this is a very fast procedure because patient is almost in a very arrest state. And the scenario is you cannot intubate, you cannot ventilate. Okay. So now for demonstration of right placement, we have given lungs also. To MO, you can see the lungs are inflating. And furthermore, if you want to further confirm, you can attach breathing fluid sensor. So we have the design EQ simulator also. So once you attach that, it will show a capnograph. If battery is discharged, but we will demonstrate sometime later on. Okay. So now what next? We will demonstrate IO access now. IO access. So next skill I'm going to demonstrate is IO access. So this is our IO access trainer, and this is our power driver, and this is our IO needle. So mount the needle over the power driver and just this is your signature velocity 1 to 2 centimeter, go perpendicularly. This is the new gravity. Stop there. That's great. And then you will get blood. This is how IO access is done. SPM is also, IO is also. These are our IO access value. You can do multiple functions. And then we have to replace the tag. The next skill will be central line.
So central line is not in the coated products.
Okay, what else is left then?
This,
But if they want to see, I can show them.
Yes, sir, yes, sir. Yeah, yeah.
Ask them.
Just show that if possible. Okay, central line.
Yes. So we have given
These are great skills. Nobody can give training on this manikins.
translation. You can see with another three carotid artery translation. And this is the triangle we have given. So I will be demonstrating IJB. Okay, intrajugular vein capitalization. So this is the two halves of the cerebral vestibule and the base is formed by the clavicle. So I will be going in the center of the triangle. That's the HVS actually. Also, you can pursue other landmark also. Okay, so just pin the carotid artery and go in the center of the triangle, aiming towards the ipsilateral nipple. So once you puncture the skin, now you hold of this skin, syringe, keep going, keep aspirating. So when you aspirate blood, you stop there. This is a manikin, so I am just pushing back the blood. And for the other port, you can insert the guide wire. So guide wire should go free. I am pushing the guide wire. You have to go up to the second lining, approximately 20 centimeters. The driver has to go inside. Move the needle. That is. You can dilate the opening by in and out and rotating movement. Now you can set the catheter over the diaphragm. The guideline should come out through one of the openings. Now to hold the guide wire and push the catheter inside. Move the guide wire. Aspirate. You can see the blood coming. You can see the blood is coming. So this is how the central line catheter is done in IJB. We have three central lines: IJB, subclavian, and femoral. So you can do at three levels. You can practice. Okay, Lukman, what else is left? Lukman,
Sir,
what else is left?
this now stop the bleed.
Okay, stop the wheel. So I'll be demonstrating stroke of bead mannequin in a minute or so. So these are our mannequins, but if you need another mannequin, I mean any other kind of mannequin, we can make these mannequins. So basically, our mannequins have proper landmark. They have electronic pulses as compared to other mannequins which have manual. And in case of tension remote tracks, I would like to emphasize that we have electronic tension remote tracks. You don't have to pump the air. And the surgical trike, you get air when you breathe the membrane. And in ICD, you feel inflation and deflation of the lung and the bubbling in the underwater drainage. So these are the additional features which no other mannequins have. And since I am a practicing ear physician and STEM educator, I have incorporated these special features because when I was learning, I had difficulty in learning these things. So now this is our stroke the bleed panicking. Basically, there are three scenarios. First is the first scenario is that when the patient simple move, you have to just keep the move pressed. And if it is a like the deep move, you have to do the packing. Okay. The third scenario is when the patient is having profuse bleeding or arterial bleeding. So if you switch on this button, you can see the blood is coming, rushing out, and this is where apply. You need to apply the catheter kit to stop the bleed. And we apply the total kit, the bleed will stop. And you have to apply the windlass. This is our stop the bleed mannequin, and this is how the catheter kit is applied. Okay, Lukman?
Yeah,
Yes,
that
sir,
is fine. Okay.
Any questions I would like to answer?
See, this catheterization trainer, have you?
No, we will separately do that, Mr. Anup. This is only for trauma.
Okay.
Which catheterization?
Male and female.
They want catheterization trainers, we separately quoted.
Police catheter?
Catheterization, urinary catheterization trainer.
No, we don't make the
Yes.
catheterization.
Okay.
Any
So
doubt
the-
on this? Any clarification? You
So
require, sir?
initially the IO, how the ventilator stimulation works on that?
On which mannequin?
Which one? The needle ICD trainer.
ICD, it will inflate and deflate the lungs. We have
Okay.
inside the thoracic cavity lungs, and that's what you feel when you are performing ICD on real patient. The last point is that you must feel inflation or deflation of the lung, and that is the point you should insert the ICD. So the ventricular.
So that you have shown in lung and thoracic cavity for inflation and deflation, finger
Right.
sweep. No, that is okay.
That's right. For ICD.
Okay. So okay, that is fine. But one more thing that we are not more into the detailing of this mannequin. So is it possible to get into one by one of the specification that provided by the company?
Oh, Lukman will
Yeah.
give you those.
Yeah.
specifications.
Okay.
I'll read out the I'll read the specification and sir will explain that.
Sure, that will be much better on this. Then I can have the
Yeah,
like
yeah.
we can start with this
ICD.
ICD.
Yeah. Sir, I'll read out the specification as per the tender.
Okay.
This chest tube trainer needle decompression. This is a ventilation simulator.
Right. We have. Yes.
Yeah. Aesthetically designed exact anatomical landmark, realistic bony and soft tissue landmarks.
Yes, they are there.
Yeah.
Now, how will the certification? How will that aesthetically designed exact how is it
By
is
looking
being
itself,
done?
we can see, no. By looking itself.
No.
it is-
I'm telling there should be a certificate kind of thing should be there. No, that I'm just want to. We need to get some light from this demonstration also. That's why we are asking on that.
No, for this anatomy model, there is no such. It's a realism. No, it should look like anatomy torso. That's all.
Okay. External angle for counting wrist space.
Yes.
Yeah.
Is there. And then you
Can
can
you Now, can you show that just what is sternal angle? Just can you just
Okay.
we need to see that on the live, okay? Mr. Lukman. Okay.
Yeah.
Now,
Sir.
live is on a monitor.
No, they want to know what is total angle of
Okay. On the mannequin?
Yeah, yes, on the mannequin.
Yes.
So the chest belt is replaceable. After 4 or 6, you can replace the chest belt. So these are the clavicle. Can you see, Dr. Ajit?
Yes, yes.
And this is the sternal nose. So just below the sternal nose, this prominence. This is the sternal angle. Okay. This prominence. So you have to count the rib spaces. Whenever you count, you have to start from the sternal angle. So the second rib is attached to the sternal angle. This is our second rib, and the space below the second rib is the second intercostal space. Then you count downward, like the second, then the third. This is the third rib. Like my thumb going inside, right? Like in the patient. This is the fourth rib. Then this is the fourth space. Okay. The space is below the ribs. So this is the sternal angle. You can feel. Actually, you will have to feel it. Okay, it is not that prominent, but I will try to make it more prominent. This is the sternal angle, and this is how to count the side for meter decompression. And now you can see the pleura also. This is what puncture. There is the blood also, and you have to replace the pleura also. And this is the lung. If you want to see inspiration definition, show the ventilator simulation. Show the simulator. We'll show you the inspiration definition of the lung also, how it works. Can you see the other thing moving in and out?
Sure, yeah, got it.
So this is like you feel through this puncture, like my finger, like yes, you are in the right space. Because sometimes you are not able to feel the lungs and the chest will go somewhere else. So this is very important. Okay,
sure.
So you are sure that you are, because sometimes the adhesions also. So the pleural puncture, and after the puncture you feel the inflation will go the lung. That means you are in the right space. You need to put the chest to there. Okay, this was it.
Okay. So that rib skeleton like a human chest, no, that is okay.
Yes, absolutely. It is like these are the ribs you can see. I'm pushing my finger between the ribs, and this is the rib. Can you see?
Okay, yeah, I can see that. Okay.
Yes.
So skin is fine.
Okay. Just see, these are the ribs. You can see.
Yes. Got the point. So that's it. Replaceable pleura after puncture 4th, 5th ICS for decompression.
Yes. You have to replace pleura. Like you can do 4, you can do 6, maximum you can do 6 ICD on one set of chest tube pleura. Okay.
Okay. Chest belt after use, that is replaceable. Okay.
Yes.
Okay. Auto sealable punctures. Okay, that is you have shown.
Auto sealable, meter decompression.
Yes. Okay. Skin incision muscle.
Yeah.
Skin. Yeah.
Chest belt, you will give skin incision like this is the skin incision.
Okay. There should be a simulation possibility, right?
Pardon?
After skin incision, there's blood stimulation should be there, not there.
No. The mannequin is not breathing.
Okay. Skin incision, which we mentioned here, muscle dissection, blood stimulation after skin incision. Yeah. Okay.
And you have to push your finger inside it.
Muscle dissection.
This is the incision, like you can see the gap. So you can give like 1, 2, 3, 4, 5, 6 incision you can give. So one chest belt I'm saying can be used for 6 candidates.
Okay. Pleural puncture giving pop sound. Something.
That's what you get. And you like. just in other space. So once you have given the incision, can you see? And you are doing the dissection. And now I'm going to puncture the Pura. This
Okay.
is the sound. Okay. And I have got loss of resistance also. Did you hear that?
I didn't hear Sajid. Anybody hear?
I'll do once again.
Yeah, yeah.
It is not a very, it's not a like very loud
Okay,
sound.
because my
Yeah,
audio is not
nearby.
that good. Yeah, that's right.
Now to nearby, but I will do once again. Just concentrate. That is it. So this is how you get loss of resistance also. Okay, and the pop sound. It is
Okay.
there. You will appreciate when you are nearby.
Okay. Okay, that can be even shown in the live demonstration once before the dispatch, right? Okay. Okay, fine. So bubbling in underwater seal drainage after ICD insertion that you have already shown.
Yeah, you have seen in the back, bubbling up.
Okay, got it. Tension pneumothorax on right side, electronically created. That is.
Yes.
So multiple puncture for decompression.
Then you can do thousands of them.
Okay. So air escape, oozing sound as air escape, air bubble in 20 ml. Okay.
Both the
Issue. Okay.
oozing
Okay.
sound and for like bubble in the syringe also.
Okay. Then we'll go to IO power driver needles, intraosseous power driver.
Yes.
We have some battery operated.
So this battery will have 400 charges.
Okay. Can you just show that battery that switches? Okay. Where it is placed?
This battery is in case this is inside inbuilt. It is not replaceable. Only we will be able to replace.
Okay. It's non-chargeable.
Yes, because the IUXS is the emergency procedure. Like it should be ready to use all the time.
So you have any browser, Mr. Lukman? You have to show that it should be for 300 plus charges that you have to show in the browser.
This is the driver. Okay. So here is the battery. So usually the imported ones are use and throw. Okay. Once you use their power driver, then you have to throw it. But we have given the option that we will change battery at a very low cost.
Okay. So can you anywhere mentioned it, which is anywhere mentioned in the browser that just 300 plus charges?
Yeah. We have mentioned on the browser IUXS and power driver. We have a separate catalog for that. Lukman will share.
Okay.
Yeah.
That regarding that 300 plus charges, LED indicator for battery, magnetic.
I just hold on. I send our catalog, the booklet for the IUXS.
Okay. Please do it with the 1.5 centimeter IO needle and the 2.5 and 4.5.
4.5 is used for humerus. We have humeral manikin also will do that, and the blue with 2.5 is the adult. But we are having a pediatric IUXS trainer, so we usually use 2.5. But I will demonstrate with 2.5 also.
No, but we have already mentioned in the thing so that we have to show on 4.5 also, 1.5, 2.5 and 4.5. Red, blue and yellow.
Yes. So this is our catalog for IUXS.
Okay.
Okay.
That is not shared, I think, but that you have to show.
This is the length of the needle. Okay. The color.
2.5 is there.
Yellow one. This is needle fixer.
So can you just show that yellow one? 4.5 also we have quoted. That's why.
Yeah, we will show you 4.5 in the numerous. Okay.
No, that is the other page, that you just show me. In the back page, what?
Yeah, this needle space.
What do you want to see?
That needle page with yellow, no, that you can show that right.
Yeah. This one.
Yeah, this one.
4.5. Okay, that we will.
We will show you the needle also for demo purpose.
Okay. Can you just show it? You have it, any of this?
Which one? See, these are the needles.
Okay.
Yellow, blue, and red.
Okay. Can you just collect it and show it to us?
You want a demo with the yellow leader also?
Yes, yes.
Okay, we will demonstrate.
And one more thing that 300 plus charges. So since you have the brochure with you, you can show that in somewhere.
Actually, we have two brochures. One is for the real patient and one is for the demo. Okay, we have to check where it is mentioned. I'm not able to. The land indicator is there. That will be activated. These are the instructions. We can. I think Rupan will share with you. The whole
Okay, sir.
Lukman, you have to show that the 300 plus number of charges that this can be updated on that. That intra power driven. And in between, they show the needle fixer.
Okay, okay.
This is the blue one.
Okay, okay. So the needle fixer is in the.
This is separate. This is like.
Oh, okay.
Separate.
Okay, got it. So for each dimension, there is a separate needle fixer, I think, right? Or
actually, we charge separate for needle fixer.
okay,
I don't know. I mean, it has been shared with you or not. Actually, initially we have just shared. I think it is shared with you. We have written IO this needle fixer and the connector also. So the connector.
okay, yeah, that has to be.
Connector also.
Okay, now got it. We can go to the next.
So this is the yellow needle and it is used for doing only numerous IO access. Okay. So
Got it. That is fine. That is fine.
So this is the this is the needle connector.
So one more thing, what about the refilling of the inks, that kind of
So
thing?
you have to aspirate slowly. So this connector and this fixer will separate from the mannequin. But not very costly. It is very cheap.
Okay,
That is our idea. We want to make very low cost mannequin.
okay, that is fine.
Coming to the humans.
That is okay. As in, doctor, we can move to the intraosseous mannequin.
Okay, now I'm demonstrating human IO access with the mannequin. So this is our human IO access mannequin, and the technique is two finger technique. You first keep one finger on the lesser tubercle, second on the lesser tubercle.
Okay, so that is showing that feeling of resistance when drilling inside the bone. Okay.
Yes, yes, you will see yourself. Just you have to stop there once you get the force of resistance. So this is the narrow UV aspect after doing the IO access. Nobody has human IO access mannequin in the world. We are the only one. We have manufactured, we have designed this human IO access mannequin also. Because in adult, when you need rapid infusion, because in humerus, the infusion rate is up to 13 liters, okay, per hour. Whereas in media, it is only 6 liters. In fever, it is 8 liters, distal fever. But in humerus, proximal humerus, it is 13 liters. So when you need rapid infusion, you have to do a human IO access. And you can do more than one IO access also. Like patient is very sick, one you can do in media, second you can do in humerus. So when you get that loss of resistance feeling, I think you will have to do to get the real feel. But this is all anything we have incorporated all the features which are described internationally and what we do in real patients, what we observe in real patients.
Sure. For that's why, Lukman, we need a live demonstration for this area because this feeling of resistance can be only. Okay.
This high-end sir will personally give a training to the liver. That's what I very initially asked. Who is a so we'll opportunity train the trainer.
Before finalizing this, that's why this has to be only in can be finalized only in the live demonstration. Fine. Okay, blood stimulation or aspiration. Am I audible, doctor?
The voice is
Blood
correct.
stimulation on aspiration.
Yeah, you see now how you have seen aspiration of blood.
I have one multiple punches. Okay, that is fine.
Yeah.
Which is mounted on stand.
Yeah, mouse stand is there.
Show the.
Which mannequin?
Because I was
Okay, we'll show it is mounted on the, this is the mounted mannequin.
I'm not able to see it in between. Some breakage is there. Yeah, okay, mounted.
And now we'll show focus.
So that. Okay. Okay.
You want to the
then-
aspiration of blood? Dr. Ajit?
The shoulder trainer you have already shown. Okay,
Yes.
that's-
Are you access?
Deep wound for packing.
Deep wound for packing. Stop the bleed.
For stop the bleed trainer.
Okay.
sir.
We will show.
Hello.
Just look back.
Sir, can we show?
Just showing. This is the deep wound for packing.
Okay.
And this is the arterial wound which will have profuse bleeding. So in this wound, you can play two scenarios. Just apply the bandage and keep the pressure. Secondly, you pack the wound because there is a hole inside the wound. Okay.
Okay, got it. So superficial wound for pressure bandage.
We will assume that this is also superficial. And in the second scenario, because then we will have to make three holes. So initially, you can have this. This is the superficial wound for packing. Just not for packing, sorry, for just putting the pressure.
Okay. Hemorrhage stimulation for rapid response.
Pardon?
Hemorrhage simulation for rapid response.
This simulation?
For rapid response, that's.
Yeah.
No. Like, see, again, I will demonstrate this from the grid. Now, this is a superficial wound. Okay.
Okay.
We will just keep the band, keep whatever we have, and then keep it pressed. Okay. This is the first scenario. This is a superficial wound. Second
Okay.
is the packing wound. This is the packing wound. Okay. Then
Okay.
this wound will have a profuse bleeding when you press the button. Press.
So that is battery operated. Okay.
Yes, that's battery operated. So just to heighten their simulation, there's a response. So you can see the bleeding coming now. So then you have to apply. We'll ask them to apply the cathode ray. Okay.
Okay, got it.
So these are the three scenarios in this.
Okay. Then okay. We can move to adult airway trainer.
Sir. Sir.
So adult airway trainer, we can.
Sir, can we show adult airway trainer, sir?
Okay, Lukman, that was all.
Sir, can we show airway trainer, sir? Airway, are we ready with airway or can we do separately?
Which one, infant or the adult?
Airway, adult.
Actually, Lukman, we had a workshop yesterday. We right now don't have a adult airway trainer.
Right, sir. We'll study it separately.
We have only infant.
Right.
Okay, okay. Sajir, just note it down. We haven't done adult airway trainer. Okay.
Okay.
Okay. Then
Yeah,
adult
sir, I
QCPR.
have one more doubt.
Okay. Yeah. We have.
Actually, what about the refilling of the ink? How much installation can
Hello?
be done per, per manicure? So, general idea.
You are not audible. Sir wants to put this thing, sir. For drama is over. Any questions related to these mannequins, demonstrated mannequins? Further questions?
Sajir, you have any question that?
No, no. Actually, I just asked about the refilling of the each mannequin.
Hello?
Am I audible?
I'm. It's your voice is cracking. Please tell me.
Yeah.
Okay. I just need to know about what are the bleed in the bleeding thing. Suppose that is gone. If any accident, that kind of thing, the blades drain out. How to refill it? That kind of information.
No, you are not probably audible. We will clarify those things via mobile phone. I think I will call mobile and clarify.
You can type your question. We will read it and
Yeah.
You please type your question. Chat in the chat.
Okay. Then so other trauma. Okay, like then from adult intubation trainer, adult QCPR mannequin.
Yeah, we'll show you separately.
Okay, infant QCPR,
Yeah.
surgical needle from. Okay, that's okay.
Surgical needle can be performed in this surgical right open airway only. You want to see that needle right?
Yes.
Okay. Surgical right
Needle भी साथ में. Needle भी. ये मोहम्मद सजीर काफी टाइम से बोलना था.
Mohammed Sajid, please type your question. I will answer.
He wants about blood supply. We will give refilling of blood, simulated blood.
Yeah, how that is refilling of blood is done. Even that was my query for me also.
Which one? Which mannequin you are talking? Please specify the mannequin. Please specify the mannequin.
Before that, we have to show that down context before the whether it is need before the dispatch or before the order. That's why.
No, you need blood refilling for which mannequin? I'm asking.
No, they're asking how to refill the blood, sir. Once the blood is over inside, how?
Which mannequin? That's what I'm asking. By your access, you have to replace the patch.
It can stop the bleed out.
No.
Okay, there is a port. You can refill it. But for IO access, you have to replace the pad.
Any of this how this
Yeah, we'll give. But with the standard accessories, we'll give a standard.
Okay. So how? Okay, regarding the
it will be
posting
repurchase. It will be these things.
Okay.
So this is the port. You can read it
Just
through
wait.
this port. So this is the port. And you can read it through this port. Blood in this mannequin. Can you see, Lukman?
Yeah, yes, sir.
So this is the port you can fill this mannequin.
You can push port inside. Yes.
We have given port in center line also in pericardial center. Wherever we have blood circulation, we have given port for refilling. In every mannequin, there is a port.
Very simple, because it's very simple method.
But for IU access, you have to buy the pad. That is not refillable. So with IU mannequin.
The sample like that is universal, no? That from anywhere we can purchase it and do it, no?
Which one?
The sample, bed sample.
No, no.
So you
See,
can,
there
you
is,
can, you can buy it from anywhere. But for IU access, you have to buy the pad. This is not
Okay,
like refillable because it will start leaking.
got it, got it, got it. So infant and other area that till now we have completed two Lookman, just one.
3 products we have completed.
ICD trainer, IO power driver, intravenous mankind, stop the bleeder trainer.
Yeah.
Then adult, from adult we need to complete,
Yeah.
right?
Yeah.
Okay.
Yeah.
So now I will demonstrate even because I don't make. So again, you have to see the space. Now for doing the needle physiotherapy, you have to stand on the head side of the patient. Okay.
Okay. Okay.
When you are doing surgery like open, you have to stand on the dominant side of the your dominant side. If the right hand is stand on the right side. So standing on the head side of the patient, consider the skin first. Going
Okay.
the seat. Keep feeling all the time. Stay. Puncture at 90 degrees. And then go coldly. Once you puncture, aspirate. You will aspirate air. Now you remove the skillet and pass the cannula inside. And then you have to connect some oxygen source. Although it is not a simple oxygen source, you have to connect the jet insufflator. Otherwise, there is no use of this surgical pediatric hydroxy. You have to use only jet insufflator. Otherwise, it will retain more carbon dioxide and it will die faster. So in real scenario, it is of no use except in children. Then you can do. You will try. That will be very good for children. But you have to use jet insufflator. Otherwise, it will not work because the human of the needle is too narrow and nothing. The expiration part will not be there if you don't use jet insufflator. So it will retain only carbon dioxide and it will, bring the barrier time much more faster. So you have to be careful when you are doing legal physiotherapy. You have to use a jet insufflator. Okay, Dr. Ajit?
Right.
Okay. Thank you, Doc. Okay.
Thank you very much.
Okay, that's all.
Hopefully others, yeah. Okay. Yeah, Lukman, others will be done, sure. And before that, one more thing. You can cross-check with Akhil and any kind of, before the PO yet to get released. So before that, a live demonstration should be provided to the Bihar team. Okay.
I couldn't get. Can you repeat it?
Live demo, I have done online demo. Live demo will be, I don't think will be possible, Dr. Ajit.
No, what do you mean? So after issuing the PO,
exercise now online then live, it will be difficult for me. That's why I did an online demo. Otherwise, you
No.
do a live demo directly.
See, live demonstration, which means the product quality cross-checking, any kind of live demonstration, usually we do that.
Live demo only, then why online demo? What was the purpose of this demo then? You should have told
No,
us.
it is, I think I'll speak with Akhil on that. Okay.
yeah.
Okay.
Okay.
So can you call it?
You can attend. I need to talk to Lukman.
Okay. Sir, we can call it.
And
Yes,
everybody
thank you,
else,
sir. Thank you. Wonderful
Yeah,
demo, sir.
thanks for
thank
your
you, thank you,
time.
doc.
Thanks
Okay,
for
thank you, doc.
time for the demo. Okay.
Thank you, Doc. Thank you.
Okay, I think Lukman is in between. Oh, okay, no. Hello.